All right, so in today's discussion, we'll look at the urinary system. So this one is just an introductory discussion of the urinary system. So the focus will be both gross and histological anatomy of the urinary system. So first of all, we are going to look at the components that this system is made up of. So we have paired organs and unpaired organs. So among the paired organs, we have the kidneys, that is left and right kidneys. Of course, these organs are located in the abdomen, that is posterior to the peritoneum. So these are retroperitoneal organs, okay, meaning they are not enclosed within the peritoneum. In addition, we also have two other paired organs, which are the ureters, left and right ureters, of course, connecting from the hilum of the kidney all the way to enter the urinary bladder, which is now located in the pelvis. Then finally, we have the urinary bladder. So the urinary bladder is unpaired. It's a single organ. Thereafter, we have another unpaired organ, which is the urethra. So the urethra is equally unpaired and channels the waste that has been filtered from the kidneys to the external environment, process known as excretion. So basically, these are the major organs that make up the urinary system. Of course, spanning from the abdomen, pelvis, and all the way to the external environment. Okay, so here the male model was used, but equally, even though we're using a female model, the organs will be located in those regions that I've mentioned, abdomen, pelvis. Okay. So these are the objectives for today, but we can skip it for now. We can look at it much later on when we are done with the discussion. Okay. So here I'll quickly skip the introductory phase and just go into the anatomical part of it. Okay. So the functions of the urinary system are quite complex. Like we are seeing, among them is maintenance of homeostasis. That is through various processes that take place in this important and vital system of the human body. Number one is regulation of water and electrolytes. So we call that as water and electrolyte balance, or simply acid-base balance and fluid balance. So these components, fluids, are essential to human body and its function, and therefore must be regulated within a certain limit. In an event that fluid is less or more in the body, that may lead to pathologies, mainly to do with altered metabolic function that may later complicate into various problems affecting the cardiovascular system, affecting the nervous system, and several other systems of the human body. Similarly, acid and bases are supposed to be regulated within a strict limit. Okay. And these are controlled by the body eliminating or conserving certain electrolytes in the body. For example, the bicarbonate ions and the hydrogen ions. So excess amount of hydrogen ions will lead to blood becoming acidic, what we call now as acidosis. Or in an event where we have excess bases or bicarbonate ions, blood becomes too basic, condition known as alkalosis. Either of those conditions are not compatible with life. They may alter various metabolic functions. The next is excretion of waste. So the human body performs so many metabolic functions, and therefore waste accumulates in interstitial fluid, interstitial spaces, which are now eliminated by the kidneys. So that is the function of excretion. In addition, we ingest various substances throughout the day. Could be a soft drink, could be some drugs, or indeed substances found in daily food. Either way, those substances may eventually cause harm to the body. Once the body uses them, the waste must be excreted. For example, drugs. All those must be removed from the body. Then the urinary system is also involved in the regulation of blood pressure. So blood pressure is an essential and vital function of the human body, because without adequate or normal blood pressure within the blood vessels, we find that tissue perfusion and exchange of nutrients between blood and tissues is altered. And therefore, the kidneys are involved in such processes. Then, apart from that, the kidneys also produce certain substances that may be referred to as hormones. Among them is erythropoietin. Erythropoietin is essential for production of red blood cells by the bone marrow. Okay. In addition, there's also a factor that is produced by the kidneys known as renin. So renin is essential in regulation of blood volume. At the same time, renin activates aldosterone, which is a hormone produced by the suprarenal glands or the adrenal glands. And as such, aldosterone will help to conserve fluids in the body, sodium, as well as cause vasoconstriction in an event that the circulating fluid volume is low to supply all other tissues. So therefore, blood will be shunned from peripheral sites and channeled only to vital organs, example given, the kidney, the liver, the heart, and the brain. Then conversion of steroid prohormone, which is vitamin D. So in the synthesis of vitamin D, the kidneys play a vital role together with the skin. And we say that vitamin D is essential for bone development, for bones to maintain their strength, structural strength, to support the entire body as a skeleton. They need adequate amount of minerals, for example, calcium. Okay. Now, to absorb those minerals, vitamin D is essential in that process, and therefore kidneys help the body to synthesize that essential molecule. Next is gluconeogenesis. So this is a process in which energy is made available from alternative sources in the body, including proteins and fat. We will see that around the kidneys, there's a special type of fat known as thermogenin. This is brown fat. It's the only part in the body where brown fat remains in adults. Needless to say, a newborn baby has significant amount of brown fat, but as they age, brown fat is no longer synthesized and therefore remains only around the kidneys, which is essential for heat production and energy provision to the body in cases of hypothermia. Let's look at the components. So this one was already tackled, so we can skip this part. We now look at the kidneys. So the first part of the urinary system, we'll look at the kidneys. So here I'll focus on the gross appearance of the kidneys. Then in another part, we'll discuss the histological features of the kidney. So let's look at the gross anatomy of the kidneys. So number one is the shape. So the kidney is said to be bean-shaped. Therefore, it has a concavity and a convexity around it. So this is a concavity of the kidney. Then this is a convexity of the kidney. So we see that in its medial surface, the surface that faces the midline or the sagittal line is concave like that. This part is where the hilum is found. This point where various structures are entering and leaving the kidney. Then the lateral aspect of the kidney is convex, as we are seeing here. So this is lateral, this is medial. Okay. In addition to that, the kidney has a superior pore and inferior pore. So that is superior pore, this is inferior pore. Then kidney will now have an anterior surface, lateral surface, posterior surface, and medial surfaces. So 3. anterior, lateral, anterior, lateral, medial, and posteriorly, where we can see in this model that we have. In terms of weight, it's quite sizable organ, weighing about 135 to 150 grams. In terms of length, roughly 10 centimeters long. That is from the superior paw here up to the inferior paw down there. Now, the most accurate description, especially when it comes to length of the kidney, is to consider the position in which the kidneys will be found relating to the spine. So we know that the spine is a vertebral bone at the back there that makes us have the ability to stand erect as human beings. So the spine has segments. So we have the cervical spine that is in the neck region, the thoracic spine in the chest region, the lumbar region, roughly around the abdomen region there. Then we have the sacral, and finally the coccyx. So when it comes to the kidneys will be found in those two positions. So we are referring to the spine here. So that is a thoracic spine. We can see rib number 12 here, and that will be the 12th thoracic vertebrae, this one here, where the 12th rib is attached to. Then this one will be the first lumbar bone. In total, there are 5. So there'll be 5 lumbar bones there. So the kidney will be found between the 12th thoracic vertebrae and the 3rd lumbar vertebrae. So that is 12, 1, 2, 3. That is a level at which the kidneys will be found. And this level, at least, is static and is not influenced by an individual's height. So whether someone is tall or short, still the kidneys will lie at that particular position. So I mentioned earlier on that these are retroperitoneal organs, so they lie at the back of the abdomen. Okay. So if you want to feel or palpate for kidneys, you have to use the posterolateral aspect to palpate for them. Okay. Now we are seeing that the right kidney is slightly lower than the left. So this is the right kidney, this is the left kidney. By the way, this is a subject that we are observing from the back. So we're looking at the human subject from the back. So if we turn and rotate this subject anteriorly, this position will be on the right. So this is the right kidney, this is the left kidney. So the positioning of the right kidney is influenced by the liver. So we see that the liver here is occupying much of the space in the abdomen on the right side. So in terms of size, if you compare the liver and the spleen, we see that the liver is quite larger, and therefore the right kidney is pushed slightly lower than the left. So superior to the left kidney there will be a suprarenal gland, and up above and posterior will be the spleen. So that is a slight variation that we see in terms of positioning. Okay. Then in addition to that, we are saying the kidney is covered by a thin fibrous capsule. So the renal capsule is fibrous in nature. So if you're examining a kidney that is harvested from a subject, you see that on the surface, the kidney appears shiny, as shown here. So that is the fibrous capsule. Before I go further to discuss some of the other features that we examine in a kidney that is sectioned, either transversely or longitudinally, I would like us to look at some of the coverings that protect the kidneys. Okay. So this is now a superior view. So this is a kidney that has been cut using a transverse section. So the subject has been cut across like this. So the plane is cutting somewhere here, across, left to right. Then we are seeing this from above. So this is a superior view after a transverse section. So we can clearly see that this is a hilum, the space that was concave, where various structures are entering and leaving the gland. Now, when we observe that, we'll see that, first of all, the kidney is surrounded by the renal capsule. We're saying this renal capsule is fibrous in nature. Then around the kidney is what we call the perinephric fat, perirenal fat or perinephric fat. Now, this fat is brown fat. Okay, this fat here surrounding the kidney is brown fat, what we refer to as thermogenin. Okay, now brown fat as compared to white fat, we see that brown fat produces more heat than energy as compared to white fat, which produces more energy than heat. Okay, and therefore, we expect to find brown fat in newborn babies to prevent them from having hypothermia. So that is renal capsule in gray there, then surrounded by brown fat, which we refer to as perirenal fat. Then after the perirenal fat, there's another layer of connective tissue, which we call the renal fascia, or simply alternatively referred to as Gerotter's fascia. So that is Gerotter's fascia around the perirenal fat. Then around the Gerotter's fascia, we have another layer of fat known as the pararenal or paranephric fat. So that is that fat there and here. So we see that the kidney is quite, protected with adipose tissue. Now, in an event that this individual undergoes significant weight loss, maybe due to an ailment, or sometimes because someone wants to lose weight and they excessively lose weight, maybe through exercises and other ways of losing fat. And this fat around the kidney is also lost in that process. So during that time, the kidney becomes vulnerable to injury resulting from either sharp or blunt trauma directed at the areas where the kidneys are found, that is posterior between thoracic vertebrae number 12 and lumbar vertebrae number 3. So we still need fat around the kidney for protective purposes. So these layers are essential, and as students, we require to know them. The renal capsule, the perirenal fat, which is brown fat, Gerotter's fascia, or the renal fascia. Then we have the pararenal fat. Okay. Now let's look at the structures that we see if the kidney is sectioned. Okay, so already here we can see that there is some different in coloration. There's this area that is lightly stained and the areas that are densely stained like that. Okay, so I'll take us back to this diagram, or we can even use this one. Let's start with this one first. So a cross section of the kidney, or indeed a longitudinal section in this case. In this case, there are two sections here. There is a transverse section and a longitudinal section there. So what we see is that there will be two distinct patterns at the parenchyma of the kidney. The parenchyma is this functional part. The core of the gland or the organ under discussion is known as the parenchyma, the actual tissue that gives functionality to that organ. Of course, outer covering is renal capsule. Now, we're saying we have two distinct zones. There are these triangular or pyramidal-shaped structure which seem to be more denser in color. So when you cut a kidney, this will appear darkish. Then the surrounding tissue will appear brownish. So this will be brown, this will be dark in terms of appearance. Okay, now we'll start with the outer part. So this outer and lightly appearing zone is what we call the renal cortex. So that is the renal cortex. Now, the renal cortex occupies the peripheral areas. At the same time, the renal cortex dips into the parenchyma of the organ and therefore splits the medulla, which is this part, which is darkly in appearance. So we have this as a cortex. Then the portion of the cortex that dips into the gland is what we call the renal columns. So the renal columns are part of the cortex. So the next structure to look at are these triangular or pyramidal shaped structures. So this is the renal medulla. So those are renal medulla, then this is the renal cortex. So we see that the renal medulla is surrounded, of course, superiorly here by the renal cortex and sideways or laterally by the renal cortex, what we call the renal columns. So these are renal columns, renal columns, renal columns. So this is cortex, medulla, cortex, medulla. All right. Then we see that there's a small zone between the cortex and medulla here. So around the medulla is a zone or junction between the cortex and medulla. So we call that as corticomedullary junction. So that is corticomedullary junction. There will be a junction in the sides as well, corticomedullary junctions, and we see that there are blood vessels in that junction, arteries and veins, which we'll look at in the next coming slides. Okay. Away from that, we look at the structure known as the renal pelvis. So the renal pelvis is the origin of the ureter. So this is a ureter. Then at the hilum there, the ureter is dilated, and that part is known as the renal pelvis. From the renal pelvis emerges 3 or 4 calyces, or you can call them branches if you like. So the first branches of the pelvis, we call them major calyces. So they are about 3 or 4. 1, 2, 3. So these are major calyces. Then each major calyx splits into 3, sometimes even 4 minor branches, which we call the minor calyces. So 1, 2, 3, 4 minor calyces. And now we see that each minor calyx is connected to one renal medulla or pyramid, if you like. So this is one pyramid with its own calyx, one pyramid with its own calyx. So as the kidneys are performing the function of urine formation, we will see that the collecting ducts will run through the renal medulla and enter into the minor calyces. Okay. And enter into the minor calyces. So the terminal ends of all the collecting ducts is at the apex of the renal medulla, which is called the renal pyramid. Okay, or renal papilla, sorry, the renal papilla. So that is the renal papilla connected to one minor calyx. So this is a calyx and its papilla, minor calyx and renal papilla, like that. Okay, then this is a base of the medulla. Okay. Away from that, we see that the space now in the renal hilum is known as a renal sinus. So that is a renal sinus found at the hilum, and this space is filled with fat. And remember that the first fat to surround the kidney is brown fat. So we call that as the renal fat, the renal sinus fat, the renal sinus fat around the sinus there. Essential for provision of heat as well as energy. Okay, so those are gross things that we'll see when the kidney is sectioned. We'll see the cortex with its columns. Then we see the medulla, which are pyramidal shaped. So these are inverted pyramids where the apex is facing at the bottom and the base facing superiorly. Then we see that the terminal part of the renal medulla is known as the renal papilla, and each renal papilla is connected to minor calyx. Okay, then we see that the minor calyces are branches of the 3 major calyces It's the three major calyces that are connected to the renal pelvis. Then the renal pelvis will emerge from the renal sinus as a ureter. Okay. So that is what we see under gross inspection of the kidney. Okay. So let's look at organs associated with the kidneys. So we'll start with the right kidney. So we see that the right kidney superiorly is a suprarenal gland, the right suprarenal gland there. That is the right suprarenal gland. Then anteriorly is the right lobe of the liver. So this is the liver here. This is the position of the right lobe. The left lobe will be somewhere here. So the liver has been removed here so that we can see clearly how the kidneys are positioned in the abdomen. In addition, anteriorly, there will be the duodenum. So this is a duodenum. Stomach is here, which has also been removed because we are saying kidneys are retroperitoneal organs, and therefore, if those organs were in situ, they would obstruct our clear view. Then lastly is a hepatic colic flexure, the right hepatic, the hepatic colic flexure, or you can simply say the right colic flexure. So this is where the colon is, the ascending colon. So the ascending colon reaches this point and then makes an arc to become the transverse colon. So that bending of the ascending colon to become the transverse colon is what we call the flexure. So it is also covering the anterior surface of the right kidney. So those are the three structures we'll be expecting to obstruct the kidney anteriorly. It's the right lobe of the liver superiorly, the duodenum medially, and the duodenum anteriorly, and the hepatic, or simply the right colic flexure. Okay. Next, we look at organs that will be posterior to the right kidney. So it will be the diaphragm and muscles of the posterior abdominal wall. I'll take you back a bit so that we see those muscles. This is the vertebral column. Then we see that muscle. So this muscle is known as psoas muscle. So that is psoas muscle. It's divided into psoas major and psoas minor. So that is psoas major. This will be psoas minor. So simply known as psoas muscle. Then we have several other muscles at the back. These are erector spinae muscles. This one and this one, known as erector spinae muscles. It's a group of muscles that enables the spine to be erect. So these muscles are lying posterior to the kidney. Okay. Then there are also abdominal muscles here, as you can see. So those are abdominal muscles lying posterior to the kidney. So it's posterior abdominal wall formed by those muscles I've just highlighted. Let's look at the left kidney. So left kidney superiorly is the same. We're going to have the left suprarenal gland. Okay. Then in anterior relations, we see that there's a spleen, stomach, pancreas, jejunum, and the left colic flexure. This time we're calling it the splenic flexure. Okay, so those are the organs or structures that you find in front of the left kidney. There will be spleen, the tail of the pancreas, the left colic flexure, where the descending colon is connected to the transverse colon, and also partly the stomach. Okay. Then posterior relation of the left kidney is the same. We're looking at the psoas muscles and the abdominal muscles, posterior abdominal wall muscles. Okay. So there we are just now comparing a kidney of an adult and the kidney of an infant. So the kidney during development is a lobulated organ. It has lobes. Okay, as we can see clearly here, demarcated by the septum of the renal capsule. So the renal capsule dips slightly into the parenchyma of the kidney to separate it into what we call lobes. Now, as the kidney develops, that is after birth, the lobes disappear. So we see that on the surface of the kidney here, lobes are not distinct, even though we can see some of the shallow grooves or sulci, which were previously partitioning this organ in two lobes like that. We see that in adult kidney, the lobes disappear. Okay. And that is why now, if you cut the kidney, you see that the kidney has those pyramids, which represent lobes. Okay. I'll take you back a bit. This one here. So, in an infant or in a fetus, a lobe will end here, where we say we have the renal column. That is renal column, renal column, renal column. So one lobe will end here, another lobe begins. So you can count the lobes: 1, 2, 3, 4, 5, 6 lobes. And they will have clear demarcation in an infant or a fetus. But in adults, the demarcations disappear. What remains are simply the renal medulla. So in short, the renal medulla, which are these pyramidal or triangular shaped organs, represent the number of lobes that were in that organ when the kidney was in an infant and when the kidney was in a fetus. Okay. So there are roughly about 12 lobes or so in a kidney. That is in an infant. Okay. So as this kid, as long as it's at this stage, the functionality differs. So this one, the mature kidney, is more efficient and effective than the kidney of an infant. So around second year of life, that's when all lobes disappear, and we see that now the functionality of the kidney, the physiological aspect of the kidney, is almost equivalent to that of an adult. That is second year going up. Okay. So we can call this as a lobe. That is the cortex around each renal pyramid. So if you cut from here going up, that is the renal lobe. But in adult kidney, we don't see those lobes unless in infants. So a renal lobe will involve the cortex, the renal columns, and one renal medulla or renal pyramid connected. So we're saying each of the lobe is connected to one minor calyx, as it were. Okay. So further examination of the kidney, now we see that there are certain lines that are seen there. They are more like darker lines. So we call those as medullary rays. So medullary rays extend from the medulla into the cortex. So we can see those lines there. So those are representing the renal tubules. Okay, so a bundle of renal tubules is represented by those medullary rays. We can't see renal tubules because those are microscopic structures. Now, the renal tubules end as collecting ducts. So these are the structures we are seeing there, extending from the cortex into the medulla, and therefore connected to the minor calyx at the renal papilla there. And then the filtrate will pour into the renal pelvis and all the way into the ureter as urine. So those are medullary rays we are seeing extending from the cortex into the medulla. Okay. So that is all about the gross aspect of the kidney. In the next discussion, we'll look at the histological aspect of the kidneys. As usual, if there are any questions, feel free to get in touch with me and I can clarify one or two things. Enjoy your day.